Do you remember the days of lockdown? I certainly do. Every night on the TV, especially the BBC News, the country was shown a rather shocking-looking graph which displayed the huge number of excess deaths caused by COVID-19, supposedly. Just to recap, excess deaths are any deaths that exceed what is statistically expected. So, if we take an average number of deaths based on the preceding 5 years, but the current numbers exceed it, those numbers will be called excess deaths. You all with me? Yeah, cool. Right. Well, what if I was telling you that in 2022, Britain had an average of roughly 1,000 excess deaths per week? Yes, about 50,000 in total. And then, what if I told you that only a small minority of those were COVID deaths? So, then naturally the question is, what's actually causing all of these excess deaths? A report late last year found that 30,000 people have needlessly died from heart disease since the beginning of the pandemic. Perhaps the vast backlogs that emerged from the pandemic are playing their role. Evidence may also suggest ambulance waiting times are contributing too. But one thing seems clear to me. All roads lead back to lockdown. For a long time, this story was ignored, but this show pursued and scrutinised it relentlessly. One other man who examined this story more than most was Michael Simmons, the data editor at The Spectator. Thank you very, very much, Michael. Absolute pleasure to have you on the show, may I say. Just talk us through what some of these findings are and what they mean to you. Is this the cost of lockdown, in your view?
Thanks for having me on. I would say absolutely this is the cost of lockdown. So as you mentioned, every week the Office for National Statistics publishes death figures for the country, and they'll sometimes split that by cause, COVID and other causes. And as you mentioned in the introduction, if that goes above the average that we saw before the pandemic, that's an excess death. And what's been found now that we have all of the data for last year is that there's about 50,000 more than average, and that's the highest excess deaths apart from the pandemic we've seen since about 1951. And if we look at the causes, a lot of it is, or rather a very small portion of it is COVID, and other parts of it look like there's a big increase in heart deaths. I know you mentioned the British Heart Foundation report that found that 30,000 deaths happened needlessly because perhaps of missed appointments. One thing we calculated in the Spectator data team is that during lockdowns, there was about 8 million missed appointments. And we now know that the NHS waiting lists are at record high. So it looks like a lot of health problems that people would have had just normally in a normal year during the pandemic didn't get treated. And then that's coming back to bite them and us now. And
how does this compare to the amount of people who were dying excess death-wise during the pandemic, the height of the pandemic, during lockdown? So the reason why we locked down, to try to limit these excess deaths, how does it relate to those numbers there? Because I was saying at the time, in my view, I think that more people might end up dying, sadly, as a result of our response to COVID than maybe COVID itself. Was that way off the mark?
So in terms of just pure excess deaths, there were more excess deaths during the lockdowns because you, of course, had all these heart and cancer deaths plus the COVID deaths. Now, we're certainly seeing in some weeks of last year, there was more deaths from all these other causes than there were in the COVID weeks. I would say that it's probably too early to say, was there more COVID or was there more lockdown-caused deaths? Because, of course, the people that are going to die because they missed treatments during lockdown haven't all died yet. There will still be people on the NHS waiting list waiting for treatment who need ambulances because of these backlogs that are sadly going to die. So the number is going to mount. And it's certainly something, that we need to keep looking at, that what is going to be the true cost of lockdown.
Absolutely. But please tell me that the government is investigating this, because I really hope that when the dust all settles, some people can at least be held to account.
Well, you would absolutely hope that the government was investigating this. And when I started writing about this in the summer, that was sort of the impression I had, that it was being investigated. But I spoke to the Department for Health today, and they said that there was no formal investigation, just that the situation was being monitored. And it's certainly true to say that they do have very good monitoring tools, but people that I've spoke to, senior in government, just don't seem to be aware of these monitoring tools. So I certainly think a proper investigation is needed, and that should definitely form part of the COVID inquiry that's going to kick off this year.
Yeah, absolutely. Now, given that we are still waiting for this to work its way through the system, COVID is still a thing, of course. It is still affecting people. And as you've rightly pointed out, all of the people who are yet to die as a response to our coronavirus crisis, i.e. the lockdowns, well, they've not died yet, have they? Or they've not had their medical conditions. The NHS is still on its knees, partly as a result of all of this. Do you think that if we look at these things side by side again now, if anything like this ever happens again, that the public should be given almost like the trade-off? So instead of just Whitty's graphs and next slide, please, of this is the consequence of what might happen if we let COVID rip, now we have a little bit of data, don't we, to imply what could happen if we, well, you know, did let it rip, actually.
Yeah, absolutely. I mean, during COVID, certainly the first lockdown, it was all focused on that one issue. And the public should be made more aware of the trade-offs. And in fairness to Chris Whitty, he did recently publish a paper where I think he made this point himself, that some of the trade-offs could have been better communicated so that people can make better choices, or just not necessarily better choices, but just more informed choices, knowing that there are costs to both sides.
Do you think this was deliberately underreported at the time because people didn't want to get in the way of lockdown?
I wouldn't say it was unreported because the ONS, published this every week. So the data was there for people to look at. But maybe the government could have had a clearer eye on it and had, look for it. You certainly, you speak to people in government who are even now seem unaware that this is going on. So maybe it wasn't so much unreported, but people didn't want to know about it.
Yeah, I think that's the key point, isn't it? People didn't really want to know. It didn't suit a lot of the narrative at the time. Michael, really appreciate you making the time for us this evening. Michael Simmons there, the data editor at The Spectator. Make sure you always check him out online as well, on Twitter, on social media. He's always got a load of great research.